The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everybody. This is Carrie Block, your Vice Chair for the LTSS Committee. It's 10 o'clock now, and we're going to allow a few more minutes to allow our virtual people to join us. So if you could just hang tight, we'll get started in just a couple minutes. Thank you.
I got a fancy version. I have a video that I'm starting.
Is anyone speaking? Is anyone speaking? Because we can't hear anything.
Unmuted.
Looks like
Right now,
Kathy.
I believe Lupe is speaking.
I'm
Hello,
sorry?
can anybody hear me?
Yes,
You can hear me.
I can hear you. Yes, this is Jill.
Okay. I know that virtual participants were having trouble hearing as well. So, okay. Good morning, everybody. This is Carrie Block, your vice chair for the LTSS Subcommittee Committee. I'd like to welcome everybody to our December meeting, and we're going to jump right in and start our attendance so we can try and keep to our schedule today. Kathy, are you on?
It looks like Kathy put something into the chat saying that she called in because she was having problems, but nobody can hear her.
Okay. That was the same problem I was having. Okay. Well, we'll work on that. Allie Cronley. Anna Warhite. Cindy Seeley. Neil Brady. Gail Weidman. Jay Harner.
Hey, Carrie, it looks like Pam Waltz said that she can't get off mute, and Cindy
Okay.
Selly is here. Or Cindy Selly said she can't get mute and is there. So sounds like everybody's having this problem. They can't
Right.
themselves.
All right. Should we just give it a few minutes to try and resolve that?
I think it's fixed now. Now I'm unmuted.
Okay. All right. I'm going to
Just start to roll over
that.
again, though.
Yep. Here we go. That's okay, because I also forgot to indicate that this meeting is being recorded. So your participation in the meeting is your consent to being recorded. And here we go again. Kathy, are you there?
And told you that it's not. So like it's a complete warning. It is. It's a complete warning. So it is what it is.
Yeah, it's too late now.
Yeah.
Okay. Kathy, are you there?
I'm wondering if there's a way I do think it's important about it.
Look, I'm not saying it's not important. Yeah.
Allie Cronley.
And that's just,
Anna Warhite.
good morning, this is Anna.
Hi, Anna. Cindy Seeley.
Yes, hi, Cindy's here.
Neil Brady. Gail Weidman.
Good morning, I'm here.
Hi, Gail. Jay Harner. Christina Frenzel. Juanita Gray. Leslie Gilman.
Morning, I'm here.
Hi, Leslie. Linda Litton.
Linda's here.
Hey, Linda, thanks for joining. Lloyd Worth, Matt Seeley.
Present.
Hi, Matt. Joe Garrett. Michael Greer. Minta Living.
Good, Carrie. In the chat, I'm sorry. In that, it looks like Juliet posted that the room's been trying to speak, and I think their room now is muted.
Yeah, Jill,
Okay.
just really quickly, we are in the room where it's.
Say that again, robot.
Can you hear me?
I'm hearing an echo.
Sorry about that. This is Montreal Fletcher. We are experiencing some difficulties in the room, so we're trying to get those worked through. So we can hear everyone on the call, but you all can't hear us. So just give us a second and we will put in the chat whenever we're ready.
Okay, sounds good.
Carrie, are you able to hear me?
Yes, I can hear you.
Great. Wonderful. Back to you to keep us going then. Thank you all for your patience.
Okay. So one more time, we're going to start from the beginning and see how it goes. This meeting is being recorded. Your participation in this meeting is your consent to being recorded. Kathy Cubitt. Kathy is indicating she's still muted by the organizer right now, but she is here.
Hi, this is Kathy. This is Kathy. Can you hear me now?
We got you, Kathy.
Oh, good. Thank you. I'm here.
Perfect. Thank you. Allie Cronley.
Here.
Anna.
Allie's
Hi,
here.
Allie. Hey, Allie. Thanks for joining. Anna Warhite.
Good morning. This is Anna.
Good morning, Anna. Kathy Bollinger. Oh, I'm sorry, Kathy is excused today. She won't be able to make it. Cindy Seeley.
Hi, this is Cindy. Can you hear me?
We can hear you, Cindy.
Thank
Neil
you.
Brady. Neil Brady. Gail Weidman.
Good morning, this is Gail.
Gail. Jay Harner. Christina Francel. Juanita Gray. Leslie Gilman.
I'm here. Good morning.
Hi, Leslie. Linda Litton.
Morning, Linda's here.
Hi, Linda again. Thank you for joining. Lloyd Wirtz.
Present.
Hey, Lloyd. Matt Seeley.
Here.
Good to have you, Matt. Del Garrett. Michael Greer.
I'm here, Carrie.
Good morning, Michael. Minta Livengood. Monica Vaccaro.
Good morning, this is Monica.
Hi, Monica. Pam Walls.
Hi, I'm here.
Hi, Pam.
Hi.
Ari. Hi there. Ari Arpinian.
Present.
Hi there. And Rebecca May Cole.
Good morning, I'm here.
Hi, Rebecca. Okay. With that, I'm going to turn it over to Kathy to run through our housekeeping and committee rules.
Thank you, Carrie. This meeting is being conducted in person and as a webinar. To comply with logistical agreements, we will end promptly at 1. To avoid background noise, please keep your devices muted unless you are speaking. Remote captioning is available at every meeting. The cart captioning link is on the agenda and in the chat. It is very important for only one person to speak at a time. Please state your name before commenting and speak slowly and clearly so the captionist may capture conversations and identify speakers. Please keep your questions and comments concise to allow time for everyone to be heard. Webinar attendees may submit questions and comments into the questions box located in the GoToWebinar pop-up window on the right side of your computer screen, or use the raise hand feature to be put in queue to speak live. Those attending in person should use one of the microphones and wait to be called upon to speak. Before using a microphone, please press the button on the base to turn it on. You will see a red light. When you are done speaking, press the button again to turn the red light and microphone off. Time is allotted on the meeting agenda for 2 public comment periods. If you have questions or comments that weren't heard, please send them to the resource account email found at the bottom of the meeting agenda and on the LTSS Submac webpage. The emergency evacuation directions are found on the back of the agenda for folks in the room, and everyone must leave in the event of an emergency and meet at Zion Church on the corner of 4th and Market. If you need any assistance, OLTL staff will be right outside the main doors of the Honor Suite to provide assistance. And with that, excuse me, I'll turn it over to Juliet for OLTL updates.
Thank you, Carrie. Thank you, everyone, for attending today, especially our friends from Erie and the surrounding counties who have been inundated with snow this past week. We are glad, Gary, that you're able to join us, and certainly are thinking about you all up there by the lakes as you're gearing up to get more snow. Hope everyone had a good holiday weekend last week. I only have a couple of light updates today. We have some important presentations, so I do want to save considerable time for those. Folks are usually used to my first slide at this point. Surprise, no news. So there are no updates to provide. The email for any questions related to Community Health Choices procurement remains open. The CHC program will continue to operate under the current managed care organizations until further notice. There are no timelines, and so please direct any questions to that email box. I had planned to talk about emergency preparedness at this meeting a couple weeks ago, and Erie County provides us that perfect example of the importance of emergency preparedness for all of our programs, for all of our providers, and for everyone across the system to ensure that we are doing all that we can for the health and safety and welfare of the participants we serve. There has been a lot of incredible work and support and backup planning that has gone into place in Erie as they experience this very significant snow event. So, I wanted to kind of highlight some resources, the community emergency response teams that are available in local communities that could provide trainings for individuals and who may be interested in volunteering or being educated further about disaster preparedness and hazards in the areas where they live. CERT trains volunteers in basic disaster response skills such as fire safety, life search and rescue, team organization, disaster medical operations, and more about how at the local levels things are connected. And there's always a need for volunteers from every community, and particularly for individuals who have experience working with people with disabilities, working within their communities. So we always encourage folks to volunteer within their communities as we all work together in any emergency situation. Also wanted to highlight some resources that are online, in particular, a PrEP toolkit and the National Preparedness System. The Preparedness Toolkit provides, emergency management professionals, folks that should be designated perhaps in each and every one of the provider agencies. Certainly each of the MCOs have emergency preparedness plans within their systems. But this embodies, the Federal Emergency Management Agency's FEMA sort of best practices for preparing for disasters, be they natural disasters, snow events, tornadoes, hurricanes, etc., to really help people prepare beforehand. So if we have notice of an event that's occurring, it provides best practices for what people should have in their homes in terms of several days worth of food supplies, water supplies, medications, identifying individuals who are reliant on electricity and ensuring they have a backup plan in the event that there might be power outages. I'm grateful in Erie County and watching the power outages that it seemed like there was minimal, like less than a couple hundred folks without power. That gave me a lot of comfort, given how cold it is these days. It talks about how folks may identify local emergency route plans, identifying potentially where there are warming stations within their neighborhoods, how to potentially navigate alternative transportation needs. I had engaged with providers in Erie, and they alerted me to the assistance that they received from the National Guard. So we were very grateful to the National Guard and to the Pennsylvania Emergency Management Team as well, agency. in helping to mobilize and provide those supports, and for, you know, providers being aware on how to access those supports to get our direct care workers safely to people's homes. So I did hear a lot of good things. I am interested, particularly for our Erie folks, as I think about the PrEP toolkit, about always how can we continually improve. And that's sort of another best practice, is whenever there's an event, to do a sort of after action plan to see how things can be improved, what went well, what did not go well, and where there might be gaps. So in this particular situation for our folks in Erie, please feel free to reach out to me or any member of the team. Usually this is the time I give out Randy's email. I'm going to give you mine and let him off the hook. I know you get all dressed up in your Santa costume. So it's, you know, I am very interested in hearing about folks' experiences in Erie ongoing. And my email is jmarsala@pa.gov. And lastly, we have another resource called Ready PA, which is a resource for Pennsylvanians that can help them take simple actions to help better prepare them and their families for emergencies. This, again, is also an online event, and in many counties and townships, it will actually allow you to sign up for local alerts so that you can get advance warning if there are emergency events happening. So wanted to talk about some of those items. Wanted to also then shift to the next page of talking about some recent Office of Long-Term Living communications that went out. One of them is very specific to the program for individuals over the age of 55. We did put out, with some additional limited ARPA funding that we had left, an opportunity for quality improvement funding for the life providers. And so under our approved home and community-based services spending plan, life providers will be provided with some ARPA funds to strengthen services provided under the life program. It is a one-time funding of up to $500,000 per approved request submission to help implement projects to improve the quality of services provided to individuals under the life program. The funding is sort of contained to be used towards improvement projects, particularly aimed to increase the quality and monitoring of services. So it'll be allowing life providers to invest in upgrades to their technology, to purchase and implement new software technology for electronic health records, to improve or make changes to quality or risk management functions within their systems, and including funding for life provider organizations to contract with a health information organization to better strengthen those connections. And so that went out on the listserv, but we wanted to highlight it here. In addition, the General Assembly in the last budget increased the life appropriation by 8.48%, which increased their capitation rates effective January 1st, 2025. The Centers for Medicare and Medicaid Services approved that request in a letter dated November 22nd, 2024. And we issued the new corresponding rate letters to our life providers immediately upon receiving approval. So those are the recent OLTL considerations. I think that's also a really good example of the importance of engaging our General Assembly with regards to upcoming appropriations and budget sessions. You know, you've heard me talk about in the past the need to really ensure we are educating our representatives, meeting with them in local districts and helping them to truly understand the value that we all know home and community-based services presents and provides across the Commonwealth. I've received numerous letters from participants And direct care workers, they've shared copies with me about letters that they've sent to the governor and sent to the representative. I've received letters from provider agencies, and so I do thank you all for taking that time and that effort to do those outreaches to educate about the importance of our programs. And keep those letters coming. I do read all the ones that I receive. So the stories are significant, and many of them are profound, and it does also sort of renew my hope, and certainly provides a lot of grounding in the mission and why we do what we do every day in our system. So with that, I get to open it up to public comments. I think we've made up some time.
Yes, thank you, Juliet. This is Carrie. We can open that up, and let's start with any committee members in the room. Do you have any questions or comments at this point? All right, I don't hear anything. So let's move to committee comments and questions in the chat.
So I see one question in the chat from Carl Berry, who is asking, when should we expect the results of the HCBS PAS rate study? And I'm happy to answer that. As stated in the previous meetings, we closed or expected to close the survey as of November 15th. We did close that survey. The survey results were provided to Mercer to continue their analysis on the wage and rate study. The data, is being compiled and drafted. It is in draft form. It is not ready for release. It has to go through an executive review process, which can be quite lengthy. It goes, in this case, it's going through several departments. So I don't have a date specifically for when it will be released, but it will likely be released in the first quarter of the new calendar year.
Thanks, Juliet. Do we have any other committee questions in the chat?
Hi, I'm a committee member. I'm sorry.
Hi, I'm not in the chat, but this is Pam Walls. Can I ask a question?
Please go ahead.
Okay. Hi, this is Pam Walls. We're excited for the chore services that are going to be added to the waiver. Will you be able to start that service on January 1st, even if you haven't gotten a formal approval from CMS yet?
Is Jen Hale on? Because she can provide a status CMS update.
Sure, good morning. Can you all hear me? This is Jen Hale, Director of Policy for OLTL.
So Jen, the question is with regards to chore services, update where we are with CMS and whether or not we would have the ability to move forward with chore services without that approval for the waiver renewal.
Sure. So we are currently, CMS is still currently reviewing the waiver renewal. We did have a few questions that we responded to, nothing of concern. Right now, we are anticipating approval by the January 1st date, but in the event that something does happen and we do not receive approval, we are not able to move forward with the waiver renewal and the services and the additional chore services until we receive official approval from CMS.
Okay, thank you.
Sure, Pam.
Yeah, but we are very hopeful for it to be approved before January 1st. CMS is working pretty swiftly on a lot of state requests for other reasons.
Great. So
Thank you, everybody, for their responses. Any other committee questions?
I have one, Carrie. This
Yes,
is Mark
please
Greer. Juliet, you said that that the preliminary report is back from Mercer. Could you kind of give us an indication of if it's going to be completed in time to be able to do recommendations to the governor's initial budget?
So draft information will be shared with the governor's office. It's the sort of, it won't be approved, like it has to go through an approval process to be released as a public report. So it's not as though that we wouldn't be sharing the data with the governor's office. I hope that's helpful.
Yeah, I mean,
their office will see all the draft reports before it's finalized as well.
So the draft reports will be shared with them then. I just want to make sure we don't miss that window to get in the governor's initial budget.
Yeah, no, there's a lot of support and a lot of education, a lot of discussions about the need for home and community-based services. And certainly, we are all sort of waiting to learn about the priorities that will be in the budget. I don't have anything to share on the priorities at this point in time. What I will say, and I will plug again, that recognizing it certainly is important to be in the governor's budget, we don't have to wait for that to be able to continue to do the education of the General Assembly, of the local representatives, to help them understand the process, because, regardless of what is ultimately whether his budget or not, the General Assembly can also add things. And so I think it's really important that we just continue to push for that education with all of the representatives across the Commonwealth.
Thank you.
Can I follow up on that? This is Matt Seeley. Juliet, I mean, it almost sounded like you said that study was irrelevant.
I did not say that, Matt.
Oh, you didn't say it directly, but I mean, if we're just doing education, how are we not? None of us are going to be able to educate them because we're not going to be able to see the results of that study.
So I actually disagree, Matt. There are lots of education that's going out. There is data that has gone out. The study is not irrelevant. The study is important. It's just not ready for public review. And I did not say it was irrelevant directly or indirectly, Matt. So, there's a lot of information. There's actually, I'm going to highlight here, a lot of significant hard work that trade associations have been doing to highlight the needs. There's a lot of hard work that CILs have been doing to highlight the need, that also happen to be home care agencies that have their own data that they are showing. That study is not irrelevant. That study is significant. It is an actuarially sound process. I do hear the frustrations of the timeline, but that is the timeline
Why would they not make this available for us prior to that? I mean, it just sounds like such an oversight.
I'm sorry you feel that way, Matt.
Okay.
Allie Cronley, Allie Cronley with United Home Care Workers in Pennsylvania. I think we just want to echo the feeling in the room that we're really in crisis in the home care space, both in the participant directed space and the agency space, around wages and the desperate need for a rate increase this year. Our members are certainly not waiting for the General Assembly. They've been active last year and are very active this year, already meeting with folks, sending letters, emails, a whole assortment of things. And I think part of what we know is when the governor makes something a priority in his budget, it's so much easier to build the support in the state legislature. And just wondering if you could speak a little bit to whether or not OLPL is recommending a rate increase for home and community-based services to the governor as part of his budget process. We certainly hope that will be happening just based on the discussion in this room over the past year and other work. So just curious if you could weigh in on that a little bit.
So as I mentioned in past meetings, the typical process that builds the budget, departments submit requests. That is not the process this year. So before it's sort of like it's just a different process. So it's sort of not ask has not gone out to all of the offices, right? It's going to be more of a top-down process. With regards to whether or not the Office of Long-Term Living or DHS is supportive of or not, I think it's absolutely clear that we are supportive. We would not turn down a single dollar invested in home and community-based services. We would welcome additional appropriations. We recognize that getting direct care workers to a livable wage is important. We recognize, the administration has recognized that getting to minimum wage across the Commonwealth has been significantly important, and that's been an issue he's talked about openly since, over the past 2 years. So it's just not that sort of the same ask, Ellie, you've heard the Secretary and I talk about how we absolutely believe that direct care workers should be making more.
Thank you, everybody, for your comments.
Mary?
And yes, go ahead.
All right, I wanted to let you know that Tom Earl has come up to the table and is waiting to ask a question if you want to move.
Yep, that's exactly what I was going to ask, if we have any public comments at this period. And we'll start with the room. So please go ahead, Tom.
Thank you, Carrie. Am I on?
No. It's not lighting up. Hold on a moment, Tom. Someone's coming to provide some support.
Yeah, I think it's a dead mic.
Technology has not been our friend today.
There we go. Can you hear me now?
Yes.
All right, I'm with Verizon. Tom Earl, Executive Director of Liberty Resources with the Center for Independent Living in the Philadelphia area, southeastern PA. Just piggybacking, and not to dwell on this too long, but the request for a rate setting, for a reimbursement rate increase for PAS has been brought up at almost every LTSS meeting. As a matter of fact, almost to the exact day last year, December 3rd, there was a huge turnout here of direct care workers, participants, and all testifying about the crisis of shortage of direct care workers, and also the fact that many of them are working at poverty level wages with no health care. And to, 2 years later, last year there was no request from the department. We were overlooked, while at the same time there was this very significant increase for ODP. And we understand that done rate structure process. Here, there's been such an absence, and piggybacking last meeting, you mentioned that this is not something that the Office of Long-Term Living can control directly as far as requesting increased funding for the rate, and that it's really up to the legislature and the governor's office of budget. So since then, we've met with the budget secretary. We've had a number of meetings with legislators, including the chair of the House Appropriations Committee, and we just want to make it clear that there needs to be something put in the governor's proposed budget, regardless of the Mercer study, and it needs to be a significant increase. Otherwise, we're going to have an issue with network capacity and the continuity of care for not only existing consumers in the CHC LTSS waiver program, but any new ones. We're turning away new participants because of the lack of availability of direct care workers, and it's really something that has to be addressed. And I was wondering, separate from the Mercer study, do we know where the other study, the Office of Budget and Finance, HR 165, I think they're looking at this too. Is that likely to come out in time for the budget's consideration?
Turn off your mic, Tom. Yeah, so as part of that, there was the ask to report to the General Assembly the average direct care wages, from, I think, 2019, and average direct care wages for 2023, and starting wages for direct care waivers. That report will be delivered to the General Assembly and made public by the due date. It should be available probably in a week or two. So you will have that information on the questions that they asked in that House bill.
Thank you.
And I don't disagree with anything that you said, Tom. It's well said, and I am very appreciative of all of the meetings and efforts that you have put forward and summarized for us.
Thank you.
Carrie, Jeff,
I'm sorry, go ahead, Juliet, I missed that.
I said Jeff Eisman is at the table to do a comment.
Okay, how about we take Jeff as the last comment or question, and then we'll move on. But I want to remind everybody, we have a very significant amount of time at the end of the meeting, so please remember your questions and your comments, and we will go back to them. So go ahead, Jeff.
Good morning, this is Jeff from Pennsylvania. So first I wanted to thank Joliet and her boss, Dr. Arkush, for attending our November 14th board meeting, where we had a robust discussion on home care and some other disability needs like accessible housing and other things. My question, and if it can't be answered now, maybe it could be answered at time with the MCOs, and this is for UPMC. There have been a number of articles recently about layoffs at UPMC and some positions not being filled. Will any of those changes impact community health choices recipients with UPMC? I don't know if you can tell us that at this point.
What I can say from the Office of Long-Term Living is we have not been made aware of any significant impacts to the Community Health Choices program. If any of our CHC MCOs would anticipate a significant impact to the CHC program based on staffing changes, et cetera, they would be required to notify us of that.
Great, thank you. And I also echo Tom Earl's comments earlier. Thank you.
Hi, this is Monica Vaccaro from the Brain Injury Association of Pennsylvania. I've brought this up before, but just to put it on the record again, we're certainly hoping that the increased needs include not just direct service providers, but also those kind of services that are provided in the context of residential habilitation, which impacts the brain injury providers significantly, and the rate increase is a big issue for them.
Thank you, Monica. Thank you, Monica. All right, Carrie, can I move us into introducing the next agenda item?
I'm ready if Kathy is good with that as well.
Okay.
Yes, sounds good. Thank you.
Wonderful. Thank you. So a couple of months ago, as part of the LTSS agenda and presentation, we had invited Frontline to come and present on their Department of Labor grant that they received to provide investments in direct care workers. OLTL is very pleased today also to have the opportunity to invite Pennsylvania Home Care Association, who is also another Department of Labor grant awardee, to come and present to the committee their direct care worker training program. As you know, Frontline is focused on training the participant-directed program. Pennsylvania Home Care Association is the leading trade association for our home care and home health care association. So very pleased to have with us today Nia Haney, the CEO of the Pennsylvania Home Care Association, and Becky Jacobs, the Workforce Development Director of the Pennsylvania Home Care Association. So we will yield the floor to you.
Can you hear me okay? Am I on as it's red?
Yes.
Okay, great. Thank you. Thank you so much for having us today. Thank you for the kind introduction, Juliet. We're really excited to be sharing this with all of you. As many of you know, and from Juliet's introduction, we were the recipients of a grant from the Department of Labor and Industry earlier this year, and we're really looking forward to getting the dollars from the grant into the hands of the direct care workforce, and just really do a couple of things with it, including creating jobs, but also creating opportunities for training and enhancement of skills. So if we could jump to the next slide there. What we developed and developed in conjunction with our membership here at the Home Care Association is a training program. And there will be 2 courses for this training program. One is the direct care worker course, and that's a track for direct care workers who are new to the industry, ideally. So these are direct care workers that have not had experience working in the home previously, or their experience is minimal. Our goal is to get as many folks into the industry that are not in the industry today as possible, but also to support those folks who are new to the industry and are looking for that skill development. The other track is for home health aides, and our home health aides would benefit not only LTSS participants, but also participants who are receiving complex care through physical health choices programs. So we are really looking forward to both of those opportunities and to creating some career pathways for direct care workers here in Pennsylvania. The next slide. So we've got a couple of program goals, and we've talked a little bit about this, but it's really about focus on improving and fostering, and that really means skill development in a number of ways. And that's competencies, of course, meeting the Department of Health requirements for competencies, meeting some of the training requirements for the Office of Long-Term Living, but also safety and compliance, empowering direct care workers so that they know what is in scope for the practice, what's not in scope, but how much that they can influence. And that includes social determinants of health and understanding what that term really means and why it's important to them in their role. Person-centered care. We talk frequently about our person-centered service plans. In fact, we have an acronym for them that rolls off our tongue without thinking, but for direct care workers, they often never hear that term. And so really starting to introduce them to these kind of broader concepts that they are ultimately executing, but maybe don't have access to that language on a day-to-day basis, and continuous learning. So as I said, our goal is direct care workers and home health aides. We expect 1,000 direct care workers will be trained through our training program in the next year, and 300 home health aides. And really important to point out on the next slide that It was important to us when we were applying for this grant and when we received the grant that these dollars went back into our communities, that they went to the direct care workforce and they went to the course curriculum. And so you can see a breakdown here, 300,000, so half of the 600,000 will go to direct care workers and to those home health aides who are taking these courses. 135,000 for the trainers, I should say, and 100,000 to developing additional course content to ensure that we're meeting all of those areas that we think are important for the skill development that's out there today. So very, very minimal dollars spent on administrative overhead in applying this program. We want direct care workers and home health aides to get this reimbursement. So with that, I'm very pleased to hand it over to Becky to take you through some of the details of the program. She is a new addition to the Pennsylvania Home Care Association and has been really instrumental in executing this grant.
Hi, good morning, everyone. I'm Becky Jacobs with the Pennsylvania Home Care Association. We are currently around goal 2 on our roadmap. So we started in July. And we created a task force and we formalized a project plan for these tracks. Present day, we are working with a strategic partner, and I will get that on the next slide, to update our Learning Center. My Learning Center, available on the Pennsylvania Home Care Association's website, is a free training site available to anybody. But we are really focused on getting this updated for our grants. We are adding new videos, we are updating the platform, and really making sure that it is user-friendly and agency-friendly. Starting in about January, we are going to start recruiting direct care workers as well as home health aides into the program. And right now, we are currently accepting applications for our home health aid training sites, and I will go through each one of those in later slides. And then through the course of 2025 and early 2026, we will be executing and providing needed data to the Department of Labor. Next slide. So we are really excited to partner with Navan. Navan is a learning management site that is taking our current Learning Center videos and updating them to their platform. They are state-of-the-art, very user-friendly, mobile-friendly, and should be very easy for direct care workers, family caregivers, agency workers to access these videos on demand. Present day, we have about 212,000 active registered users, and that number rises every day. We are looking to do our 2024 snapshot here within the next month or two. We've issued over 5.5 million certificates through the training, and about 1.6 million video views are done annually. Presently, we have about 89 courses, and we are working to establish courses in different languages as well, and having subtitles on all of the videos as well. That's actually going to launch in January. All right, next slide. So as Mia mentioned, we have 2 tracks, the DCW track as well as our HHA track. Our direct care worker track is going to support 1,000 direct care workers. And they will receive $150 at the end of their training. So it's really easy for direct care workers to apply. They'll apply through our website. They can be referred to us. I will also be helping our agencies to recruit direct care workers directly from high schools, refugee resettlement areas, and many more. Oh, I'm so sorry.
Excuse me, this is Carrie. Becky, can you get closer to the microphone? We're having trouble hearing you on the virtual side.
Absolutely. Is this better?
That is better. Thank you so much. Please continue.
Appreciate it. So our direct care worker application will be live on our website probably beginning of January. And the basics for the direct care worker site is to complete all of the Learning Center videos. It's about 12 hours of training. Then to accept a job offer within a home care, home health, or hospice agency. Work a minimum of 40 hours and complete a satisfaction survey. We're really looking for these individuals to be brand new to the industry within the first 6 months of their career in home care. Okay, next slide, please. Our home health aid track is going to also launch in January. It will provide a $500 learning stipend to 300 home health aides. The track is very similar to the direct care worker track. However, they also need to complete a 16-hour classroom training. Next slide. And we are really excited to be able to also support the training sites for these home health aides. So what we have decided to do is that we are following the federal regulations for home health aid services, in addition to our own standard best practices, including that the classroom size is greater than 500 square feet, that there's no more than 20 students, that there is available durable medical equipment there in site for individuals to be able to use. We can support 300 trained HHAs that are trained, and we will reimburse the training sites $450 per student trained. Next slide. We have a lot of measurable indicators for progress, so we will be tracking about a dozen different items, including from applicants interviewed to how many individuals are hired, how many individuals are being retained at these agencies, employer and employee satisfaction. So we are going to be staying in close contact with the individuals through the program, the 1,300, as well as the training sites, to be able to ensure that everything is running smoothly. And then the next slide, we have a couple things that we really want to see from our direct care worker and home health aid training sites. We want to increase recruitment, attraction, support of the direct care workers and home health aides by providing structured mentorship and training opportunities, fostering growth and professional development within a supportive environment. We also want to increase retention with these sites, and then also increase job satisfaction, promotions within their agency and within the field. And that will take us to the end. If anybody has any questions, we'd be happy to answer them.
Hi, this is Monica Vaccaro from the Brain Injury Association of Pennsylvania. I'm just wondering if there's anything in the training content about cognitive impairments related to neurological damage. I see something on Alzheimer's and dementia, but cognitive impairment that comes from other non-degenerative processes can look very different and needs different management. We get reports from families with great frequency that care workers in their home don't understand the behaviors and have difficulty managing them, and it can be quite problematic.
I'm hoping you can hear me. Yes. I have the course list on hand with me here today, but I'm happy to look into it. I believe we do have one on TBI. But if there is content that you have come across that you thought was really excellent, we are, every single year, we're making more videos to add to this learning center, and we'd be happy to add that to our roadmap for future years.
Great. So if we can see the training content, I would know what might be added, what we might add for the future. That'd be great.
Yes, if you go to my learning center, there's a list of all of the courses readily available today.
Thank you.
No problem. You could just go to pahomecare.org and click on Learning Center, and it'll get you right to that site.
Got it.
Other questions?
Lloyd Wirtshire, behavioral health advocate. Just wondered if from a 10,000 foot point of view, can you share some of the depth and breadth of the training in both behavioral health issues, perhaps substance use issues, and of course, cognitive decline issues that you might be sharing with the home health aides as they prepare to work in the homes of their clients?
Oh, thank you. So happy to share with you the entire list. I know that there's a number of courses that address behavioral health concerns, and there's at least 5 that I could recall of because I was just working with someone on this recently. It's been probably over a year since I've taken those videos myself, so happy to dive into that with you. And again, if there's course content that you don't feel we're meeting, we're happy to add it. Really should emphasize that over the course of the 10+ years that my learning center has been up and running, we've received funding from the Department of Aging and also from various other funding sources to create this content. And even one of the MCOs was critical in delivering 16 more videos this year. All of our course content gets created in partnership with folks from the various departments that are funding or that they connect us to. And so we have worked with one behavioral health MCO in developing some of that content.
Thank you. Has there been additional content suggestions sought from participants in the program or their family members?
We get suggestions via multiple routes. So we get them via email, we get them from our registered users. They can contact us through the system. We also get them from the health plans and from the Department of Aging in the past.
So Mia, it looks like there's also a question in the chat for you. And so the question comes in from Joe Angelelli. I apologize if I got the name wrong, Joe. How can this training be linked to value-based programs with managed care organizations? What is the mechanism for tracking impact on quality and supporting agencies with more funding to do more? And are participants receiving care from these direct care workers? Lots of questions. Were direct care workers and home health aides asked for their perspective? I think that's what he intended to write.
Really excellent questions. What I would say is that the Home Care Association would love to partner with our managed care organizations on a standardized curriculum that meets all of the current regulatory requirements. We have worked with them to ensure that the content meets the current regulatory requirements. And won't say all of them, but with enough of them that I think that we could get consensus pretty easily. We have not gotten to a point of including these videos in VBP programs. And I know that all of the MCOs have a different approach to those programs. And they're very focused on ensuring that they are addressing certain HEDIS measures and other quality measures, and we'd be happy to engage in those conversations. We just have not to this point.
Joe also wanted to ask, can someone develop a listing of all the direct care worker training programs that will be funded in 2025 by federal and state agencies and private foundations, perhaps as part of a check-in on the pre-pandemic DCW blueprint?
I am unaware of any specifics related to that, so I cannot answer that question.
This is Carrie Block. Can you tell me if there are any plans to expand this program to other counties?
Yes, great question. Thank you. So we have reached out to the Department of Labor and Industry and requested an expansion for this to be statewide. They have indicated an openness to do that, but they would like to see our initial launch with applicants going through the program successfully for a period of about 30 days. And then they would work with us in a multi-step process to expand it. It doesn't seem insurmountable, and so we're really hopeful that we'll get there in early 2025.
Thank you. Do you have other questions?
Hi, Carrie. This is Juliet. I think a question for the committee would be Pennsylvania Home Care Association indicated their measures of success. If it is of interest to the subcommittee to invite them back at a later date to kind of review their progress and success. You know, certainly I'm sure Mia would love to come back and share those measures with us.
Hi, this is Shanrika Pine. We did have a question just come in from Amanda Lapino. Amanda's question is, for the online learning center track, do you have any knowledge-based checks? Is there a way to provide that the worker is actually taking the class and watching it?
Great questions today. Thank you. So if you are a member of the Pennsylvania Home Care Association, agencies can get administrative access to the back end of this system, which would allow them to see the coursework completed by the direct care workers who have self-identified as being part of that agency. You can, in that capacity, run reports to see completed courses, how far they got in each course, literally to the second. You could also download any certificates that were generated following a course completion. At the end of every single course, there is a quiz that the individuals need to complete, and they have to get a passing score in order to receive a certificate of completion. If you're not a Pennsylvania Home Care Association member, you don't get access to that administrative back end, but your direct care workers will be issued that certificate, and they can get it emailed to themselves and forward it on to your organization. So that does not preclude you from still having your workers use the system. Carrie, I don't see any questions in the room, and I don't see any further questions on chat. Thank you for having us.
This is Kathy. I had a quick question. Are any of the training videos available in a language other than English?
Yes, today we have multiple videos that were actually taped in Spanish, and I believe we have a few in Russian. Come January 1st, all of our videos will have closed captioning in multiple languages. So that is an expansion from where we are today, and that should be live on January 1st, barring any IT complications to go live.
Thank you.
No problem. And I just want to thank, over the years, many folks and many on this call have been part of the filming of these videos. We make sure to include organizations who are providers, but also their workforce. So there are live, actual direct care workers from the Pennsylvania market throughout all of these videos. And you'll see that as you go through, that this is real footage, these are real people, and these videos are made for Pennsylvania. There are many videos that speak to the Pennsylvania regulations and the Pennsylvania footprint. And so this is a good value asset for all of you, and I hope that you use it and that you promote it, because it is free. And so even if it's not a requirement of a particular agency, it is wonderful to just allow your workforce to know that it's here for their use if they would like to.
Well, thank you both, Mia and Becky, for this presentation and your training program. We appreciate your time. And with that, I think we'll move on to our next agenda item, which is the participant-directed budget authority model. And each of the three CHC MCOs are scheduled to present. And I'll leave it up to the room who wants to go first. Thank you.
So, Kathy, I have the presentations in front of me. So it looks like AmeriHealth Caritas won, and they get to go first.
Hi, good morning. This is Heather Lawson. I'm the Director of Service Coordination Oversight for AmeriHealth Caritas and Keystone First. I will be presenting today's topic of Participant Direction Services My Way Budget Authority. Next slide, please. First, we wanted to talk about, with our service coordinators, they receive training and resources on how to effectively coordinate and collaborate with our participants to develop their person-centered service plan. So during the planning process, the service coordinator reviews the service delivery option with participants in addition to the other services, the other waiver services for which a participant may benefit from. So when we talk about a personal assistance services directed model, we often we talk to the participants regarding participant direction and specifically with Services My Way. So during our training process, the service coordinator is trained on how to discuss the Services My Way budget authority model in terms of overseeing recruitment, hiring, and training direct care worker, as well as the participant's autonomy to decide who provides their care. In addition, the service coordinator is trained on discussion regarding the participant's discretion to use the supportive goods and services that best meet their quality of life. Next slide, please. So including in our training of how we discuss the Services My Way benefit, we talk about two different pieces specifically. We talk about the benefit of the participant directed model, so how to utilize participant direction, what that benefit looks like in terms of how it can best meet the goals. But also the goods and services. So ways that, like it says in the presentation, ways that purchasing appliances, medical equipment, supplies, etc., can really help to mold the person-centered service plan in a way that prompts independent living within the community. Next slide, please. So when we meet with our participants and we discuss model of service and services through all of our contacts, we discuss the role of the service coordinator as it pertains to Services My Way. And in essence, the service coordinator acts as a liaison to support the participant through the enrollment process, the authorization of services, as well as the maintenance of the benefit. So this includes completion of the comprehensive needs assessment, discussion of the Services My Way enrollment and responsibilities of the participant and the caregivers, as well as assisting with making the referral to Tempest, assisting with the enrollment packet as needed, and following up with ensuring that the participant and the CLE is established with Tempest and obtains the employee identification number. In addition to the service coordinator's assistance, we also have a dedicated team member who works directly with our participant-directed participants who help to ensure the enrollment's done completely. They help to maintain oversight of the budget. Next slide, please. So this is the next steps. I'm sorry, I kind of just covered all this. So during the meeting, the service coordinator will discuss what the budget is. They will look at the hours, they'll look at the goods and the services that are reviewed. And then at each contact, that not only will they ascertain the participant's satisfaction with Services My Way, but they will also offer any technical assistance that might be needed if there's any programmatic concerns, and to look at the implementation and modification, if needed, of their spending plan. Next slide, please. We have two success stories that we wanted to share with the group. So this is directly from a participant's caregiver who was his mother. This participant had some struggles with maintaining and oversight of his personal assistance services. And when the Services My Way was introduced, the participant and his mother enrolled with the Services My Way, and he was able to attend an art camp. He has goals regarding his artwork. So part of his person-centered service plan, he went to an art camp to help to enrich his art skills and for the socialization part. So his mother reports, JS continues to keep busy with art, which he loves. I realized just being cared for wasn't enough. Now he has a purpose. A lot of this is due to the Services My Way program, which we've been so fortunate to be part of. Next slide, please. Another success story that we wanted to share, that we had a participant who suffered an injury that affected dexterity of hands and legs. So since the pandemic, the participant had had a difficult time with finding agencies that were able to staff him, maintaining an aide on a regular basis for various reasons. When the participant and also with his family members, we assisted him with transitioning to the Services My Way model of service. And in that way, he was able to increase his wages for his direct care worker. He obtained an action track chair to explore the outdoors. And then he was also able to get some additional medical supplies, which was helping to cut down on his frequent emergency room visits. In addition with this one, his parents were able to take a vacation out of state for over a week. And they said that when they left, they knew that he was in good hands, that he had the services that he needed, and the model was working well because they were able to get the aides in place who really were meeting his needs to live independently within the community. I think that's our last slide. Okay. Thank you.
Thank you, Mary Jo. I guess maybe we'll hold questions after all the presentations. I'm not sure which set of slides is queued up next.
So we have PA Health and Wellness.
Thank you.
Good morning, everyone. Can you hear me?
Yes.
Okay. Hi, my name is Wanda Proto. I'm the operations manager at PA Health and Wellness. And as AmeriHealth just presented, we will present to you the participant-directed budget authority model, known as Services My Way. Next slide, please. So what is Services My Way? Services My Way is a program designed for our Medicaid-eligible Pennsylvania residents. In the program, the participants able to manage their budget to support their personal assistance services, their PASS needs. They can select a caregiver. This could be a neighbor, it could be a friend, it could be a family member, excluding spouses or a legal guardian. The participant works with the service coordinator collaboratively to determine their needs, and they determine, what those PASS needs are to develop that budget, and which is a piece of this program that is different from the traditional PDO model, is how they could utilize it for goods and services. The participant decides when, where, and from whom to buy those goods and services. Next slide, please. So first, the participant, if they're interested in Services My Way, would make this request by speaking with their service coordinator. During an in-person visit with the participant, the service coordinator will complete a person-centered service plan, the PCSP, to include the request for PASS hours to be supported through Services My Way. The service coordinator would review the program and educate them on Services My Way. It's important that when they're working with the participant that they let them know that this program should primarily support their PASS needs. And just like with the traditional PDO program, that they stay within the budget, within the authorizations that are established. PASS hours is how the budget is calculated. Next slide. All right, the unique aspect of this program is that you can bank dollars for a specific item that would not be covered in their existing health plan. And this should be listed on the PCSP. So that would be a conversation that the participant would have with the service coordinator. And that item that they would be banking dollars for should meet one of the criteria listed here. Could decrease the need for other Medicaid services, promote or maintain the inclusion in the community, promote the participant's independence, increase the participant's health and safety in the home environment, develop or maintain personal, social, physical, or work-related skills, Increase the ability of an unpaid family member and friends to receive training and education needed to provide support or fulfill a medical, social, or functional need, again, identified on the participant's PCSP. Next slide. So here's an example of how one participant is utilizing Services My Way. This participant has 69 hours of past services. They have diabetes and they use insulin. What they would like to bank dollars for is a small apartment-sized refrigerator to store her insulin. And when you look at that previous slide, this is something that would help promote and support this participant's health and safety. Placing a small refrigerator in the room, say the sitting area, living room, where they spend a lot of time so that they can easily access that. This goal is noted on that this particular participant's PCSP and how much she plans to save each month to reach that goal. The SC works with the participant to identify a vendor and determines the cost and how much is going to need to be saved each month to reach that goal. Upon reaching the goal, the vendor paperwork is submitted to Tempus, and then an authorization is set up under Procedure Code 1901, which is for goods and services, which in turn pays for the purchase of that item. Next slide, please. Now, participant number 2 also has 69 hours a week of past services, but this participant likes the flexibility of Services My Way. He recognizes that paying the full max rate, which is the amount of pass hours that are calculated based on the region rate, and that number, understanding that that max rate gives the ability for him to say, I have a direct care worker who's been working with me for X amount of years, they have seniority. But maybe I have another direct care worker that just started with me. It allows him to pay them at different levels, recognizing the seniority of the direct care worker that has been with him the longest. He also recognizes that dollars are needed. There needs to be a bit of a buffer there. If, say, those 69 hours, 1 week, one of those 3 direct care workers is working overtime, that needs to be recognized in how those dollars are managed to be able to pay out that overtime. This individual is not interested in banking anything for goods and services, given how he's using the program. Next slide. So when we look at the challenges and opportunities with the program, important that the participant determines how much they're going to pay their DCW without exceeding the max rate. So the max rate is calculated based on that region rate with the support of Tempus, and making sure that the participant is primarily supporting their pass hours. So if they have 69 hours a week, they make sure that they're able to receive that number of hours based on the rate that they're paying, and that they also provide a bit of wiggle room there if sometimes there is overtime. One thing that we've done this year in collaboration, all 3 of us as MCOs, is we've updated the Services My Way manual, which is comprehensive, which I've noted there at the bottom. That's available on the Tempus website. So if you want to jump into that, it's high level of detail, soup to nuts, that is available out there. We also, as PHW, have updated our Services My Way training for our service coordinators. And the other thing as well, which is a requirement by the contract, is our service coordinators document the conversations that they have with our participants when they have past needs, because past needs, the first thing that they should be discussing with them is participant-directed option, whether it be the traditional model or Services My Way. Next slide, please. At this time, I will pause. I understand we're going to take questions after all 3 MCOs have the opportunity to present.
Thank you, Wanda. Appreciate the presentation. And I guess now we'll move on to UPMC.
Good morning. Can you? Okay, I had to get closer. Sorry. Good morning. I'm Dave Garrett, Senior Director of Clinical Operations for UPMC Community Health Choices. And I will skip to the highlights since we've covered a lot about the basic model. But we're talking about, obviously, the budget authority model under personal assistance services. So we can go to the next slide.
Excuse me, David. This is Carrie again. Can you step a little closer to the microphone?
I will. Is that better?
Yes,
Sorry.
that is a little bit better. I apologize for the interruption. Please continue.
No, it's okay. It's I will try not to bump into it. With Services My Way under the budget model, really it is one of the two options that folks have when they're self-directing services, and it is an extremely underutilized option of services. Most individuals, when they think of self-direction, focus on the employment model, where you have authority in kind of hiring and firing and setting schedules for direct care workers. But under the Services My Way model, you have the budget authority, and this offers the greatest opportunity for participant kind of control over how their services are going to be received. It gives them choice in not just kind of what services they're going to receive, but how they're going to do that, as well as some additional ability that we'll touch on to pay their direct care workers a little bit more. Next slide, please. So again, the process starts with the comprehensive needs assessment of the participant and the service coordinator, where they build out what services, what needs the participant has, what preferences they have. As part of the conversation, the options related to self-direction, both the employer model as well as the budget authority model are discussed. If individuals are interested in Services My Way, they then provide some additional support in connecting them with Tempest to discuss how to set their budget within the model. Next slide, please. Just some of the specific examples of items that individuals can use their funding for. They have to support needs that are identified within the person-centered service plan process, but they are designed to decrease the need for other Medicaid services, promote and maintain inclusion in the community, promote independence, as well as increase or improve individuals' health and safety within their home, as well as to maintain personal goals. So that is one of the things that we've seen more utilization of within Services My Way is when folks have continuing education or other interests that they want to pursue related to the option. It also increases the ability for unpaid family caregivers to receive training to support participants, and it can fulfill individuals' medical needs. Sorry, I want to make sure I'm on top of the microphone. Next slide, please. Any participant really is a candidate for the option. Obviously, participants receiving home community-based services who are interested in self-directing and have that greater level, or interest in having a greater level of control of how those services are utilized, are important. The individuals themselves can also have designated representatives to support them in that process. And our service coordinators will work with participants to identify the needs, as well as help identify the goals that they have within their person-centered service plan, and develop spending plan as well as monitoring that plan, because it's important to make sure that if you're saving up some of the funding for an item, that you're maintaining progress and tracking that to ensure that you have enough money to support that goal. Next slide, please. In the last year, under UPMC, we have seen a 100% referrals for services my way. I will acknowledge, though, that I started with it's an underutilized model. So 100% from a small number is still a small number, but we are seeing interest uptick within this model, and we want to continue to grow this because, again, it does support the greater autonomy for the participant. Next slide, please. We have increased some of our training. Part of the reason for the increase in enrollment has been some of the support we've been doing with our service coordinators to increase training, helping increase their understanding of the program, to then articulate the benefits to participants. And again, we've seen an increase following that training and following some of the additional resources to our service coordinators to have more participants utilizing this model. And we are interested in continuing to grow this opportunity because it does provide that greatest participant autonomy and ability to make their own choices in care. Next slide, please. Just a couple of examples. This is for one of our participants who had been previously been relying on direct care support to do laundry, but wanted to utilize their services by way budget to purchase an actual a washing machine, so that she then had the independence to do the laundry by herself and when she wanted it, and it really made a big difference in her independence and well-being in the community. Next slide, please. This is also another example of one of our participants utilizing services my way, who really like the opportunity to increase the amount of pay for direct care workers through this program. They were able to have kind of less hours necessarily that they were utilizing, but were able to provide a higher wage for the direct care workers, which enabled them to attract and retain staff where they had struggled with that previously. And so they're very, you can see just how supportive of the model it is and how life-changing it has been for the participant. Next slide. I believe that takes us to the questions.
Thank you, David. And with that, I think we can open it up for questions. We'll start with the folks in the room.
Hi, Lloyd Warcher. I just wondered if the programs, the MCOs can share the number of enrollees that are engaged in this mode of service delivery.
I will start, and again, I prefaced it by saying it's a small number, and it is 10 currently. So 10 for UPMC.
In the entire house?
Yes.
Hi, for AmeriHealth, similar to what David said, it is a lower number. We are around 10 as well.
This is Wanda Prota from PHW. We have 3 members.
Thank you. To add to Lloyd's question, this is Kathy. How many do you have in the more traditional participant-directed model? Are you able? I'm not sure if you're able to answer that today.
This is David for UPMC. I don't have the exact number on the top of my head, but it is over 3,000 individuals in traditional participant direction.
This is Heather from AmeriHealth. I don't have the updated numbers, but I can get them. It's about 3,700 last count, but don't have the specifics, but if needed, we can get those for sure. Thank you.
And this is Wanda from PHW. I'd have to follow up on that number with you.
This is Juliette Marcella. I'm going to do a shameless plug for the Office of Long-Term Living Data Dash that is updated monthly on the Department of Human Services, Office of Long-Term Living Data Report. That includes the numbers for individuals participating in traditional participant self-direction in both our fee-for-service system and our managed care organization. So the next monthly report should be out any day now. Thank you.
Thanks, Juliet. Are there other questions in the room?
Oh, Kathy, yes, there's a question from the audience. Tom Earl is at the table.
Go ahead, Tom. Thank you.
Thank you, Kathy. Tom Earl from Liberty Resources. Great effort on this model, and we'd all love to see an increase in the participation in self-directed services, what we call consumer model in the old days. But on this, it's critically important that the direct care worker who's hired by the individual have access to the care plan or the person-centered plan to see the ADLs and IDLs that are necessary that were assessed with the consumer's input to live as independently as possible. Are the care plans or the person-centered plans shared with the direct care workers by the MCOs?
So this is Juliet. The participant services care plans can be shared with anyone at the participant's direction.
Understood, but I'm asking the managed care entities.
So consistent with what Deputy Secretary Marcella stated, we share the service plan if the participant wants it to be shared.
Thank you. And PHW? For many of the consumers we serve, we've been receiving care plans from two of the MCOs, but we still have not received care plans from the AmeriHealth, and hopefully there's future plans to do that so we avoid duplication with the participant and can make sure that we're addressing their needs.
Tom, this is Juliet. If you have participants who have requested that their care plan be shared and they have not had that happen, I would be interested in receiving that list and those examples.
Okay, thank you.
This is Kathy. Any other questions from the room?
I think so. Anthony is coming to the table. And a lady whom I don't know, so please introduce yourself. Is coming to the table.
Hi, I'm Erin, and I have the waiver through AmeriHealth, and it's not really a question that I have, but more a comment and frustration on my end that I'm dealing with. I've put in several requests for home modification through the waiver. Most recently, my father passed away in March, and he was a huge part of my support circle for being able to live on my own in Harrisburg. And when he passed away, that obviously went away. So I talked to my support coordinator to put in the paperwork for getting a ramp through my back door, and most recently to get a generator. The first request that I had was for getting like a stair lift, not like the chair glide thing, but like, because I'm in a power wheelchair, I don't walk, I don't have the capability to walk, and I'd like to live in my house, which I've owned now for 10 years, and and it's a great location for me to be able to go and do everything that I need to do in my everyday space for me and my dog. I'd like to age in place there, you know, and close to other family members so I can see my nephew and things. But as I get older, my mobility and ability to climb the stairs, I crawl up the steps now, but, you know, as I get older, that's going to get harder. And when I'm upstairs, then I don't have access to my chair to be able to move around upstairs. So doing things requires more effort and using more of my energy that I would like to use elsewhere to enjoy my life versus spending it on climbing steps and whatever it is that I need to do upstairs. I requested to have a ramp put on to my back deck so I could have access to go out the backyard, whether, you know, it's in case of an emergency, should there be a fire and the front door is blocked, or if there's some sort of maybe a windstorm blows stuff around and the front door is blocked, or for some reason someone were to break in through the front, and if I'm able to get to the back door, I can get out. There's emergencies that happen, and most houses and able-bodied people have the ability to go in and out multiple doors to their home. I have one, and I have a ramp for my front door, which wasn't covered through the waiver at all. Actually, I had to go through OVR to get that versus anywhere else. And then I also recently requested to get a generator because I do use a power wheelchair for everyday movement, mobility, everything. And if the power were to go out, you know, I also need to be able to charge my phone because that is my way to contact anybody else that I needed help with something. So I got denied for all of those. The first two I appealed. The third one I just got the denial. But it's strange to me how when I appeal it and I speak with the people on the panel for the appeal, you know, they state that, you know, it makes sense. They talk about, for instance, the elevator lift for in my house. They're like, well, could you just use a like manual wheelchair upstairs? I don't have that ability with my hands and my arms to grasp the wheels, you know. And I wouldn't request something. I don't need it. I've had the waiver for 10 years. I've never requested anything before. And I need these things now because my life has changed. And I've lost things in my life now that can't change it, bring it back. And I mean, my dad always, if power went out, I would always tell him, hey, power went out. So he knew, okay, if it doesn't come back on in a couple hours, he'll come over and get me and take me to his house. Because even something as simple as like, you know, opening and closing the fridge, you're not supposed to do that a lot when you have the power go out to keep the food better. But for me to open and get something out of the fridge or put something back in the fridge, it takes a lot longer for me to do it versus anybody else to do it, which may take like 15, 20 seconds. Whereas me, it's going to take 5, 10 minutes because of just movement and positioning of my wheelchair, everything like that. And it's really frustrating as a person with a disability, feeling like I have to jump through so many hoops just to get something to make my life a little bit easier so I can live independently in the community, not have to go live in a nursing home or a group home somewhere like that. Because no reason that I should have to. I just want to live in my home, be able to do the things that I want to or need to be able to do, have the ability to have a second door that I can exit my house or enter my house should I need to. And, you know, AmeriHealth is telling me it's not medically necessary. I mean, I just got a new power chair, and they said that the power seat elevation on my chair is not medically necessary for me to live independently in my home. But I can't raise my arms very high at all. And so how am I supposed to reach items on the counter or like stove or even the washer machine, dryer, if I'm not able to raise my chair up? How is that not necessary for my own independence? And yes, they say, oh, well, you have home health aides. You're right, I do, but I'm going to go back to what you guys were talking about before. The rate for payment is terrible. You can't get reliable people. I can't tell you how many people like are just not reliable because the pay sucks. Like, and these decisions are being made, but how many people are actually really affected in the same way that people with disabilities are affected every day by the decisions made by other people that have no idea what it's really like? That's really all. Thank you.
Thank you, Erin. Erin, if it's all right, if you're able to stay, I'm going to ask that Randy connect with you. Meeting's over to get additional information.
Absolutely.
Thank you. So, Kathy, I don't believe there are any comments in the room related to Services My Way at this time.
Yeah, from members that have joined remotely, does anyone have any questions?
Hi, this is Pam Walls. I just wanted to say that it seems like there needs to be a better way to get really detailed information to participants about Services My Way. It's a confusing model to try to understand. Today's presentation really helped me understand it better than I've understood it in the past. It's sort of confusing, like how does a budget get made? What is it based on? How does it relate to the number of, how do you get money beyond PAS? It sounds like you have to kind of reduce your PAS hours. There's sort of complicated things to understand about that. And also, like, what kinds of goods and services can you use it for? And I'm pretty sure that when service coordinators are going over all the different models with participants, they can't go into the level of detail that we just got. And if you don't get that level of detail, it's really, really hard to understand what this really would be, which I think must be part of the reason that it's so underutilized. So one thing I was thinking about is, like, how do you get this across? Because you really kind of need a lot of detail, kind of like what we just got. Which the service coordinators just realistically can't do. I just wonder if something like a video explaining this model that could be shown to participants might be helpful, because this is, of course, a chronic problem. And I think I'm kind of still just understanding it myself kind of clearly for the first time today. I just think it takes something that's more than a person just talking to them and describing it fairly briefly in the way that service coordinators need to do in order to have people really understand what this could mean for them and to be able to consider it in a real way.
Hi, this is Dave Jern from UPMC. We have looked at different kind of training options, as well as what has been utilized in some other states and programs related to the promotion and expansion of self-directed services. I think one of the things that we've looked at and have discussed in different forums is a model often referred to as support brokerage, which are individuals who are really experts in this, which is, I think what some other states have seen as a key to helping expand this type of service. I know within UPMC, and we've had some discussions about how we might be able to support that type of arrangement within the CHC program, because again, in other jurisdictions across the country, to grow the model, to your point, you do need somebody that has a level of expertise that can spend some time talking to the participants, answering some of those questions. We try to equip the service coordinators with as much information as possible, but they also are responsible for conveying lots of different things, right? From all sorts of services within the waiver to other measures that we have to ensure that they're conveying. And so it's something that we're looking at as far as some of the best practices nationally in this. We have developed some dedicated trainings within our team. That's partially why we've seen an increase in enrollment. And we want to continue to look at ways to support that, because it takes more time to help folks understand and answer some of those questions than possibly some of the other services within the waiver.
Hi,
Yes,
this is Heather. Sorry.
Go ahead, Heather.
Thank you. This is Heather from AmeriHealth. Much like David said, we've also are having exploratory, initial conversations with some of the support brokers. We're really putting a heavy reliance on training our service coordinators as to how to present it, how to discuss it, what role they can take to help with participants understanding it. We're also looking at additional training opportunities for our participants and how we can get in front of it, much to your suggestion, Pam. And we are continuing to build upon some of our relationships and partnering with advocacy groups such as SEIU. So we have identified, ways that we would like to implement to move the needle with the model.
And this is Wanda Proto from PHW. I certainly would echo what both MCOs have just shared. We have put together updated training for Services My Way for our service coordinators. And, Pam, I'll underscore what you said, but this model does have a level of complexity to it that a participant needs to be able to embrace because they're managing a budget. As opposed to the traditional PDO model that folks are using.
Yeah, thanks. I'm just wondering if I could ask a follow-up question. Could folks who talked about using supports brokers to help educate people just say a little bit more about who these supports brokers are and what they would be doing?
So I will, this is David from UPMC. I'll start and the others can certainly chime in. So the support broker would be a dedicated individual, often with actually some financial background, who will help the participants build that spending plan and help kind of build a budget within the service model. They in different states, again, I think there are different models where sometimes they will do that with an in-person visit for participants. They can also provide some telephonic assistance, but they're really a dedicated individual that can help educate the participant on the model help them develop a spending plan and as well as manage their budget, and really kind of they focus solely on this particular service as a specialty, and really are available to participants to answer questions, and help go over various reports that would happen on the budget if folks are kind of spending too quickly or underspending in a particular context. But it really is a dedicated person that helps the participant navigate the budget components of the process.
Thanks, that's helpful. Is that currently available?
Not under the CHC program.
Okay.
This is Heather. I would echo what David said, so thank you, David, for that explanation. AmeriHealth is doing the similar, and again, we're also in very early conversations, but thanks, David, for setting that up to explain how we are also doing it.
And this is Wanda. Definitely agree that those sorts of programs could be very helpful to this model, but I can't speak to any specifics as it pertains to what we're doing here at PHW at this time.
Okay, thank you. This is Kathy. Other questions? Oh, it looks like Juanita Gray has a question. Did you want to unmute yourself, Juanita?
So it looks like Juanita may be having difficulty unmuting. The question that she posed in the chat is, when will it be available in the CHC program?
As far as a service, that would have to be added by the Office of Long-Term Living, but I know we're looking at it in kind of different avenues. I don't specifically have a timeline on that as a potential value-added type of benefit through UPMC Community Health Choices.
But also to be clear, the Services My Way program is currently available in Community Health Choices as well. I just want to make sure we got both of those out there. Kathy, there are questions.
Thank you. Are there other questions from members that have joined remotely? All right, anything in the chat?
Hi, Shanrika Pine here. We do have several questions in chat. The first question comes from James Lee. We were informed that Services My Way participants could no longer increase the wages for their direct care workers. Is this correct?
Without knowing the specifics, in general, the wages there is a ceiling on wages because they have to fit within the rate as well as the ability to pay applicable kind of taxes. But there isn't a specific kind of restriction on direct care workers being able to receive a higher wage as long as it fits within the, again, that cap, which does allow for the applicable federal taxes to be paid.
Thank you, Dave. The next question also comes from James Lee. James, I also noticed that you have your hand raised. At this time, you are being unmuted, so you can ask your question.
Thank you. I apologize for that. Hi, everybody. This is James Lee. I'm an attorney with the Pennsylvania Health Law Project. I've been working with some participants in the Services My Way realm, and I've ran into multiple issues. That's why I put these questions in the chat. Most of my experiences come with UPMC, but the questions, I guess, can be for all three plans. I do understand, like, as Pam Waz was saying earlier, that there's no master list of covered goods and services. But I've also found that there is also not the normal denial notice that comes with these. So can all three plans speak on what the process is like to review a request under Services My Way and whether or not it's approved? And if it's not, if it's denied, are there appeal rights for the participant?
So this is David from UPMT. The participant and service coordinator, and as well as any those involved in the person-centered service planning process, will work on developing a budget and spending plan, which will include items. The items, from the service coordinator's review, they really make sure that first of all, that there's enough money for those items, as well as that the items relate back to an identified goal or need assessed within the plan. That budget is also reviewed with Tempest, who's the fiscal intermediary agent, to ensure that it meets, again, the applicable requirements. If there are I think, if there is a denial of services, we do offer those agreements or appeal rights for non-covered services. If it is something that, again, is not identified or discussed through that person-centered service planning process. So the appeal rights do exist for the services, and the review process, again, starts with the participant and service coordinator, then is reviewed by the, reviewed with Tempest. If there is a denial of service, it is also reviewed by the Utilization Management Department, and notification is provided to participants.
Hi, this is Heather from AmeriHealth. Thanks, David, for that. Similar to what David said, our service coordinators work with our participants on the care planning, person-centered service planning part of this. They come together to review the plan, and then it goes through our utilization management team. And much like David said, these services do have appealable rights and denial notifications, and it would go through our regular process for appeals and denials.
This is Wanda from PA Health and Wellness. Same process here at PHW. And I'd just like to reiterate, I think most of us presented the criteria that needs to be met when someone is banking dollars for an item. So it's really important that the participant has that conversation with the service coordinator about what that item is, and that's what's important in that person-centered service planning when they're talking about Services My Way and how the participant would like to utilize that feature.
Thank you for that information. I will say that this information that was presented today is new to me and to the participant I was working with regarding what can be covered under the Services My Way budget. I will say that when we spoke with the service coordinator and the service coordination team, and again, this is just UPMC, but they had no idea what was covered under the Services My Way budget. There was contractor issues, and resulted in this participant losing 3 years of budget under the Services My Way plan. So what I was just really asking moving forward is, do each of the plans have a contact person that can handle Services My Way issues? As I understand, it is an underutilized project, but when you have these issues, it seems that nobody, at least in UPMC, could resolve the issue in any time period. So again, this client lost 3 years, so I'd be wondering if you would be able to have some sort of liaison for these type of issues moving forward.
Hi, this is Heather again with AmeriHealth. As mentioned in my slides, we do have a dedicated team member who works with our service coordination team to review the Services My Way model, budget restriction or budget updates and such. So we do have an internal person that's able to assist.
Yeah, and at PHW as well, we have a team that handles our participant-directed option requests, which includes Services My Way. And we work closely with our account managers, who in turn with our service coordinators. So if any questions arose as far as a request, those would definitely be funneled through our team, and they would be able to assist. And good about the training that we've expanded upon this year. And as I mentioned in the slide, when we presented out on Tempus's website, there is a comprehensive Services My Way manual that I think that you would find valuable.
Hello, this is Dave from UPMC. We also have a team that can support service coordinators with Services My Way cases, and I would be happy to discuss the specifics of the case you're referring to kind of separately.
That would be great. Thank you. That's all the questions I have today.
Thanks, James. Our next question comes from Janice Miner. Am I correct that supports brokers was initially a service in the Community Health Choices waiver?
It was not. This is Juliet.
Thank you, Juliet. The next question comes from Shauna Eakin. Another reason this program is underutilized is the lack of reliable workforce, which goes back to the rate of reimbursement. Sounds like those using it have a lot of people in their family working as paid attendants.
Thank you for your comment, Shauna.
We also have a hand that's raised. Rick Hoffman. Rick, you are being unmuted.
Hello, everybody. Can you hear me?
We can.
Okay. Well, sorry, we're in the North Pole in Erie, Pennsylvania right now, but wish we were there. One statement would be on the service broker model. You know, I know very little about all of this, but it sounds like this should actually be a SIL function because nobody understands the independent living philosophy better than a Center for Independent Living, and to help explain that, the nuances of Services My Way to individuals with disabilities. Because I tell you, I work in this space with service coordinators all across the board, and they know very little, and it can be very confusing. So I think, you know, a service broker should be a Center for Independent Living. So that'd be something to consider. That's just a statement. My question on this program is, are benefits like pest eradication, assistive technology, home modifications, are all those a drawdown on the Services My Way?
They are not. The participants still have access to other waiver services. The Services My Way budget is built off of personal assistance services.
Okay, thank you.
Hi, Shanrika Pine again. At this time, we do not currently have any questions in chat.
Thanks, Shanika. This is Kathy. It looks like Juanita wanted to, I don't know if Juanita can be unmuted for her question comment.
Kathy, thank you so much. And now
Oh, go ahead.
I just wrote that the majority of the coordination teams in AmeriHealth Keystone First CHC gives participants major issues with utilization of the Services My Way program, and they continually deny participants' requests no matter what they are. And lastly, their panel is always against the participant.
Thank you for your comments, Juanita.
Welcome.
Okay, are there any, we're, I guess, moving into our public comment period. I don't know if there's any final questions for the MCOs on this, but they can certainly be handled during public comment. So with that, let's circle back to the room. And is there anyone in the room with anything for the public comment?
Lloyd?
Hi, Lloyd Werther. Just wondering, there has been considerable negative impact financially on the MEMCOs and other healthcare managed care organizations due to the lack of apparent preparation on the part of the establishment of the actuarially sound rates imposed by Mercer in dealing with the public health emergency unwinding. So does that exist also within the MCOs that are dealing with the CHC program, or is that concept not in play here?
So it's what's transpired with behavioral health managed care organizations and their primary care factors, which is each of the counties, is a different structure and system than community health choices. So if you look at the sort of the PHE and the rates year over year, you know, generally speaking, in community health choices, we have not had a similar problem. You know, that being said, the actuarial rates are a range. It is a prediction. So what's predicted and what the final outcome is, or, you know, it's hard to say about where we will land in 2024.
This is Allie Conley. We have had some previous discussion about including direct care workers on this committee, and I'm just wondering if there are still vacancies that need to be filled. My understanding is a couple of direct care workers have actually applied through the application process. I'm just curious if there's any updates or what the process around filling the vacancies, if there still are vacancies.
I'm going to follow up with you on that, Allie, to take a look at that. There are, I believe, still 2 vacancies. There are applications that, if I recall correctly, that are being considered. I know at least one of them is participant, but I can follow up with you again on that. Yeah, because there's also probably going to be upcoming vacancies, because as we change to LTSS as one committee, there are term limits. So we'll be looking at those term limits for all the members as well.
Thank you, appreciate that. Yep.
So I saw a comment coming in during the first public comment period. I can address that. The comment or question is, as a home care provider, I appreciate the blackout period regarding CHC, but it is December now. Can you share any idea why so close to 2025 we still don't have any more information? It is stressful to be in the state of limbo regarding contract renewals as an agency providing care to hundreds of consumers. Thank you for any insight. So this was Elizabeth. Unfortunately, it seems like Elizabeth has left. But it speaks to, you know, perhaps the opportunity for me to clear up some confusion. As I expressed earlier in the meeting, yes, the procurement is at a stay and there's no updates on the procurement, but that means operations move forward as they are today. And to add some additional clarity to that, operations moving forward sort of as they are today means that the 3 current CHC MCOs will continue their work and continue their services until such time as there is a change. All 3 managed care organizations have entered into another contract agreement with the Office of Long-Term Living. So I assure you, you know, when things change, there will be a communication plan. Things have not changed, I don't have any updates, means nothing is changing. Providers who are enrolled with the 3 CHC managed care organizations, continue your work, continue your relationships. The CHC managed care organizations in operation today will continue their work under the extended agreement. Just as a reminder, everyone in the room, agreements are generally 1 year in length. So really, there's no changes to that process. It will continue until such time as there's updates to share. So please kind of don't worry, don't freak out. What's happening today is continuing for this next year until there's such a time where I can provide an update.
Hey, Juliet, this is Carrie. Are you able to explain the difference between a blackout period versus a stay? Because we went from blackout period, which, you know, understood that department's not able to speak about it, but then it switched to language of a stay, and it sounds like nobody's able to speak about it. What's the difference between those two and what triggers it?
So a stay, generally speaking, is a directive to the office that we have to cease our work with regards to the implementation of the CHC procurement because the procurement process has not ended for whatever reason that may be. So that's what a stay means. In August, you know, there was an announcement that there were selected organizations and an intent to move forward. Since August, we, as the office, were instructed that we were in a stay, and that means that we cannot move forward. And so that is kind of the process where we are now. You know, a stay oftentimes is in place because there might be entities that are protesting. So similar to a blackout, during a stay, there is nothing that the agency can do to move forward the work with the selected applicants until that stay is lifted.
Thank you. I think that's a very helpful explanation for a lot of people who are in that limbo period. So thank you. If we can continue on with other questions. I think we were looking into the chat.
Yes, Shanrico Pine here. This question comes from Anne Marie Roby. How will providers and residents notify of the increase to their personal need allowance?
So the increase to the personal needs allowance that went into effect for the nursing facilities, the notification to the participant comes out of the Office of Income Maintenance, and they provide notifications to residents and the facilities.
Thank you, Juliet. This next question is from Carl Berry. If the study is complete in the first quarter of 2025, then will the study results be used for the OLCL proposed budget?
So Carl, to answer your question, the data that is collected as part of the rate and wage study will be forwarded to the governor's office and the budget office for consideration, even if it's not fully finalized, and it'll be taken under their consideration.
Thanks again, Juliet. This next question comes from Joe Angelelli. Thank you, Angelelli. What percent of the LIFE grant funding is expected to go toward quality improvement versus technology purchasing?
I don't have an answer to what percentage is expected. The percentages of spend will be dependent on what the Office of Long-Term Living receives as requests from the provider organizations putting forth their plans to potentially utilize the grant money. So I don't have any set expectations at this time.
Doesn't the HIE have money to put towards onboarding life programs, and how many life programs are on or not on the HIEs already?
Joe, I don't know the answer to those two questions. They're certainly good ones. We will have to get back to you on a follow-up after I ask the question and review the data for my team.
Thank you, Juliet. This next question.
This is Carrie. I just wanted to chime in very quickly and remind everybody that when those answers are available to the questions that are taken back, those are being sent out by listserv now. Okay, that's all. Go ahead and continue with the other questions.
Thank you. Thank you. The next question comes from Janice Minard. Can OLCL or one of the CHC plans explain how the budget can work in Services My Way? Perhaps an example would be helpful.
Hi, Janice. I'm not sure if Heather from AmeriHealth Caritas is still on and wants to be the first up to provide an example. I know there were a couple provided in each of the presentations, but perhaps additional information might be helpful.
Okay, I'm sorry. Yes. So an example would be something like deferring or moving some of the money from what would be for PAS to buy an air conditioner. So if a need for an air conditioner could help to minimize any ongoing barriers or obstacles with service delivery or health and safety, that's an example where the money would be used as for a good. So an air conditioner. And then our dedicated staff person that we talked about earlier would help to monitor the budget to ensure it's within the budget, and then how much money would be left, and they could save or bank towards other goods if needed.
I have Pennsylvania Health and Wellness coming up.
Hi, everyone. This is Joe Elliott from PHW. Janet, we provided an example of a participant who used insulin and used their budget to purchase a refrigerator so that the insulin was more easily accessible for them to utilize in their common areas of living in their home. This met the kind of health and welfare safety for the participant as one of the items that goods or services that could be purchased through the Services My Way program.
Thank you. David?
David from UPMC. The two examples we provided in the PowerPoint presentation, one was similar to Pennsylvania Health and Wellness's example of purchasing an item that the individual purchased a washing machine so that they could do their laundry at the frequency in which they wanted to do that, as opposed to relying on direct care workers to have to do that, or informal supports. And the other example was them being able to, instead of paying what may have been $12 an hour for their direct care worker, they may have been able to offer $15 an hour as a wage to attract and retain direct care workers to support their son.
Just as a follow-up, this is Shanrika Pine. Janice Minard did comment that she did follow the examples that were provided by the CHCMCOs. She wanted clarification on how the budget amount is calculated.
Certainly. So simplistically, it's not simple, but to make it simple, I guess, is the person is assessed for a certain number of hours a week, and then the dollar value of those hours are what are utilized then to determine the budget. So for hypothetical purposes, if it's 10 hours the person's assessed for, and the equivalent of that is $200, that would be then built into a weekly budget amount that the person can determine how they would like to allocate that $200.
For the record, David is using made-up numbers. Just so folks, just for the record, this is Juliet.
Janice says that was helpful. At this time, it looks like we do not have any additional questions in chat, and I'm just checking for hands raised. We do not have any hand raised at the moment also.
Thank you, Shanrika. This is Kathy. Are there any other questions or comments? I think we need to check in with our remote members. Any questions, comments from the remote side?
I have a question.
Is that Lloyd? Oh, go ahead. I'm sorry.
I continue to be intrigued, Juliet, by your comment earlier at the outset of the meeting that the governor's budget process this year will be more of a top-down rather than a bottom-up engagement. And I'm wondering, will that apply to all of the offices that are part of DHS? Will that apply to other departments like education and folks? So everybody is going to get a budget number from the governor from the top down?
No, what I am specifying is the governor is setting the priorities for his budget, and then the departments will work towards those priorities.
Okay, thank you. That's helpful.
Hi, this is Shanrika Pine. We did have a question come in through chat. This question is from Samantha Louise. If protests take place throughout the procurement process, this prohibits the selected applicants from moving on to the readiness review process, correct? How long can protests prohibit this from moving forward?
This is Juliet. That is a perfectly good question to be emailed to the procurement team in the open email message. Beyond that, I have no comment.
At this time, we have no additional questions in chat.
Thank you. This is Kathy again. Any other questions, comments from remote members joining remotely? Then anything else in the room?
This is Juliet. Since we have lots of wonderful people here in the room, I'm just going to do a shameless plug that this afternoon we will also be holding the Consumer Subcommittee meeting, which is another advisory meeting for our Medicaid programs, which was held in the Keystone First building. And I believe we are starting, is it today, this afternoon? 1 o'clock. Yes, 1 o'clock.
Thanks, Juliet. And I'll also mention, just to give folks a few more minutes to add in any questions or chime in. Our next meeting date is January 8th, and from 10 to 1, both remotely and in a new location in the Forest Room in the Commonwealth Keystone Building, 400 North Street in Harrisburg. And for those of you who attend the full MAC meetings, that is the location where when the MAC holds in-person meetings is held. So I did want to make mention of that. And our 2025 dates did go out. I believe it was with October's meeting follow-up information, so all the dates there, and I'm sure they'll be posted soon on the website, our LTSS MAC website for all the dates for 2025. There are 2 dates where we will be meeting remote only. I know I believe February and March. And so, but anyway, all that information should be posted soon and again is in that meeting follow-up document. So with that, I don't know if there's anything else that came into the chat or anyone in the room or members joining remotely have any thing they want to ask or comment on at this time.
Hi, Shanrika Pine here. I just wanted to mention that we do have an information packet for the new location. There are packets on outside at the door. It has backup instructions, parking, locations, and also how to get to the room. So if you're in the meeting in person, those are located just outside the door, and we will be sending them out later.
Thank you. That's helpful to know.
And this is Juliet. Since we have additional time and folks listening in, I'm going to do a shameless repeat plug of the Office of Long-Term Living Data Dash that is issued monthly on our website that gives, for folks who have not seen it before, information about community health choices enrollment data by region. It gives information about enrollment in our life programs. In these updated reports, we also have a breakout by gender, by age, for each of our enrollment sort of population groups within community health choices. You would be able to see the number of individuals that are being served who are in community health choices that are not nursing facility, that are NFI or nursing facility ineligible, nursing facility clinically eligible, receiving HCDS, nursing facility clinically eligible, receiving services in a long-term care nursing facility. You would be able to see the breakout of dual eligible participants, Medicare and Medicaid, by each of the regions. You would be able to see the market differences between all 3 CHC MCOs. You'd be able to see the CHC MCO's breakout of participant self-direction. I could go on, but all this to say there's a lot of data there, so please feel free to visit that monthly report. If you have questions, our team would certainly be able to help you and would be happy to help. But there's a lot of good stuff on that report, and so giving it a shameless plug since we have time.
Thank you for that information. And for members, that link is, I provide that link in our monthly meeting agenda requests. But yes, that's very helpful information. Is there anything else, either in the room or from members joining remotely or that have come in the chat in the past few minutes?
There's nothing in the room, so I would take this opportunity to share my holiday wishes for everyone, since I may not see you until the new year. So I wish everyone happy, healthy, joyous time, and wellness and safety as many of us celebrate many different holidays through this month and next.
This is Kathy. I also want to join in those sentiments and wish everyone well, and thanks everyone for their time and participation. And I do want to check in with Carrie if there was anything else you wanted to add before we adjourn.
Thanks, Kathy. I don't have anything to add right now.
Okay, thanks, Carrie. So unless anything has come in, I think we could take a motion to adjourn.
Motion to adjourn.
Second that motion.
Thank you all, and thanks again.